Hello everyone, Dr. Suneel Dhand. Welcome to another video. I want to share with you a rather disturbing story that I recently heard about a doctor that was alleging some serious issues with regards to data manipulation and data integrity in a medical study, and he faced rather serious consequences. Let's dive into this story then. So here we have the story in Medscape, which is a respectable medical publication. Doctor faces apparent retaliation after alleging data manipulation in published trial. A rheumatologist was suspended from a professional society and his license to practice medicine was threatened after he raised concerns about data manipulation in a published study for which he recruited patients, according to documents seen by Retraction Watch. That is quite an opening paragraph there. What a series of consequences that doctor faced for raising very serious concerns. What exactly happened and where did this happen? The study added value of anti-CD74 autoantibodies in axial spondyloarthritis in a population with low HLA-B27 prevalence was published in Frontiers in Immunology in 2019. So that is a very specialized area of rheumatology basically. It has been cited 13 times according to the Web of Science. In its acknowledgements, it listed Fouad Fayad, a rheumatologist at the University of Saint Joseph and Hôtel Dieu de France University Medical Center in Beirut, as one of the researchers who recruited patients for the trial. So this happened in Lebanon, but I'm going to explain to you why the story you're hearing could happen in any Western country. I haven't been to Lebanon myself. I can't speak for the medical culture over there. I visited Israel and Cyprus, which are very close to Lebanon. I do actually love Lebanese food. You couldn't get better cuisine. And actually I have a lot of healthcare colleagues who have Lebanese backgrounds, but I have never been to Lebanon. Again, I can't speak for Lebanese medical culture, but I think we can draw a lot of parallels with what you're about to hear with any Western medical culture. So Fayad alleged that the researchers tested patient samples multiple times and used a mix of old and new values in their analysis. After he reported his concerns to the journal and then the university, which both concluded that they could not confirm or refute his allegations, he has faced apparent retaliation, including the suspension of his membership in the Lebanese Society of Rheumatology. Whoa, they couldn't confirm or refute his allegations, but they still suspended him from the medical society. The article then goes on to talk about comments to Retraction Watch. The corresponding author for the study noted that the two investigations did not find data manipulation and said the issue was based on a background of personal and professional conflicts. Then there was a video interview with Fayad, who explained that he was originally an author on the paper, but after expressing concerns about the methodology to the other authors, they didn't respond to him and his name was dropped from the author list without warning or explanation. And apparently in the video there were issues with the study showing graphs that indicate very poor correlation between the old and new test results from participant samples. Was the actual journal Frontiers in Immunology, which is quite a decent sized journal, I've heard of them before, were they contacted? In October 2019, Fayad contacted Frontiers in Immunology with his concerns, but the journal's investigation was inconclusive, and a staffer on the research integrity team told him in July 2020 to contact his institution to investigate, according to emails. Fayad did so, but apparently there was a rushed and incomplete investigation, he said. It began in September of 2021 and concluded 2 months later that the investigation committee could not confirm or disprove his allegations of data manipulation. He said the statistical reviewer did not receive all of the relevant documents, although he had provided them to the university. So of course it's always important to remember, especially in any medical or scientific story, to remain objective. No matter what angle you are coming from, there are always two sides to every story. A university official sent the findings from the investigation to the Lebanese Order of Physicians, Beirut, which decided to suspend Fayad's membership in the Lebanese Society of Rheumatology. It's needless to explain the damage resulting from this suspension, Fayad said. It then talks about the decision, and a copy of the letter cited the university investigation finding Fayad's allegations to be invalid, as well as a letter in which he alleged mismanagement of the Rheumatology Society. Then there's a quote here as to the bureaucracy involved and who exactly can suspend his license. Was there any other investigation concluding that there could well have been data manipulation and problems with integrity? The Lebanese Order of Physicians Tripoli conducted its own investigation and confirmed the existence of manipulation in the study data and failure to respect the data integrity, according to an official translation of the investigation report seen by Retraction Watch. It then talks about the lead author of the study, who said that this investigation could not be considered as final or official. And there was one quote from Fayyad at the end which I thought was particularly striking. Fayyad added, "The beauty of science is that the truth will always prevail and cannot be obscured for a long time." So that is quite a story there. And my initial thought is, obviously there has to be a full investigation into a story like that. And there should never be any consequences, whether it's a physician or any other health professional or any professional at all, before a full investigation is conducted. In fact, many would say there shouldn't be any consequences for anyone who is a whistleblower who is acting in good faith and raising concerns. There should always be a subsequent investigation, particularly in medicine and science. I mean, what are we if we can't even trust the actual data? Think about whistleblowers as well. Protection for whistleblowers is paramount. I mean, how many of the biggest scandals in history have started with a brave whistleblower coming forward? We cannot go after whistleblowers and have them face consequences before an investigation is conducted. We have a big problem in our field of medicine and science, and this goes back centuries, and it's as true as the reality of human nature. This attitude that anyone who raises concerns and questions must face consequences. The mob goes after them. The mob-like behavior in medicine and science is absolutely unacceptable, and we should really be past that in 2022, but we are not at all. Obviously, in this circumstance, we're talking about a story regarding data integrity. But the truth is that this mob-like behavior pervades all aspects of medicine and science, especially if a doctor or another professional is putting forward questions, concerns, or even raising new theories. I mean, let's think about the history over the last few hundred years. Some of the most notorious examples. Galileo, one of the most famous scientists of all time, 17th century Italy. He proposed that the Earth rotates around the Sun, not the other way around, the Sun rotating around the Earth. His colleagues around him were astounded, and at that time the entrenched power structure was the church. They put him on trial and he ended up under house arrest for the rest of his life. Fast forward to the 19th century, Dr. Semmelweis, the Hungarian physician, who was observing that doctors who were helping mothers give birth were having much higher mortality rates than midwives, and he realized that it was because the doctors were not washing their hands. He told the doctors around him, "You must wash your hands." He was met with fierce opposition. Doctors were highly offended and they piled on him. He ended up actually going crazy. It's a very sad story. He was admitted to an asylum and died at a young age. And then we have Dr. John Snow, also in 19th century England, who realized that cholera outbreaks, which were killing so many people in London, were due to contaminated water. And he was isolating water pumps that were the source of the cholera outbreaks. Of course, at the time, professionals around him thought that his theories were unacceptable, and they were also very afraid about how the general public would put up with those theories because it was so groundbreaking that water could cause infection. Of course, we now know that he was completely right, but he also sadly ended up dying at a very early age before his brilliance was recognized and before it was understood that yes, water was spreading disease like anything. So those are some of the notorious examples from the last few hundred years. Why is the field of medicine and science like this? Why do we pile upon people who are proposing anything new, raising concerns or questions? I want to share with you a great meme that was circulated only within the last few months online. Of course all scientists agree when you censor the ones who don't. I thought that was absolutely fantastic. I don't know who that gentleman is, but he was really onto something. Medicine and science is no different from many other fields because humans are humans. There are entrenched power structures, whether it's about power, whether it's about control, or whether it's about money. Doesn't really make any difference with the underlying human psychology behind piling upon people who deviate from the norm, who challenge you. And of course, we always have the feeble minds in charge who don't like being challenged. So let's come back to this story then about Dr. Fayad, who raised serious concerns about data integrity and manipulation. He shouldn't face any consequences whatsoever. It doesn't look like a full investigation was done. And I've made my feelings clear on this particular topic before. I think issues with regards to data integrity and data manipulation are much more widespread than we could even imagine, because the reality is it's stunningly easy to do if you want to and you have the bad motivations in place in the closed field of medicine and science. It's actually not a hard thing to do and get away with. So we really need better checks and balances because it makes a mockery of good science and medicine. So those are my thoughts. Let me know your thoughts down below. Dr. Suneel Dhand, thanks for listening. Do hit the subscribe button for more similar videos in the future. You can also follow me on my uncensored platform where we have more open, honest discussions in a less constrained, less censored environment. We have open discussions. That link is down below, as is a link to my newsletter. We will speak again very soon.